All right. Next exercise that we're going to do here is we're going to stretch our piriformis muscle. We talked a little bit about this in the hip, but the piriformis has a big influence on the back also. So this is a stretch that you'll provide to a lot of your back patients. So the first thing we're going to do is same thing. What I do now, you can teach in the clinic, and ultimately you can have your patient do at home too once they know what to do and you've educated them on the stretch. So the first thing you're going to do, we're going to stretch the right side. So you're going to have your patient cross the left heel over, or excuse me, the right heel over the left knee. Put it so that the ankle is kind of resting there. And then what you're going to have your patient do, the first one I'm going to do is just have them stretch. So this is something that you could have them do in the clinic and ultimately at home. But you're going to have them bring their left knee towards their chest, left hand on the outside of the thigh, the right hand through the middle, also grabbing the back of the left thigh, and then just pull the knee towards the chest. Once they get to that end point, they're going to count to 30 seconds and feel that stretch. Make sure while they're doing the stretch that they're relaxed, that they're breathing, and they'll feel this in that right buttocks. After 30 seconds, we'll slowly lower that left foot down back towards the ground. And if they need to, they can bring the right leg down and rest it. Or if they're okay, just have them wait about 5 to 10 seconds, and then we would repeat this 5 times. I'm also going to show you how to manually stretch the piriformis using the reciprocal inhibition technique, PNF. It's a hold relax technique, just trying to work on fatiguing those muscles so that you can get a little bit more of a stretch. And this most likely would be done in the clinic. So what I'm going to do is have the patient, same thing, grab this time with their left hand kind of up onto the shin of the right leg, and then use their right hand to support the knee. They can relax the left knee back down. Okay, then you're going to support kind of around where their hand is, just on the outside of the right ankle, around the malleoli, and then you're going to use your other hand to kind of support around the knee. And what you're going to do is take them into that stretch. Okay, once they get to that point, you're going to have them at that end range, you're going to have them hold that, and they're going to actually be pushing into internal rotation or resisting into internal rotation as I'm stretching them, or not stretching them, but pushing them further into external rotation. We're going to count to 5, 3, 4, 5, and then relax. You're going to take them into a little bit more external rotation so they feel that stretch. We're going to hold that for that 20 to 30 seconds. And then I'm going to have her push again for 5 more seconds into internal rotation. I'm resisting that. 3, 4, 5. And then I'm going to stretch her a little bit more into external rotation. We're getting a pretty good stretch there. Jen is a runner, so she's got her piriformis muscles a little bit tight. So that's the second one. We'll do one more time after 30 seconds. I want you to push into my hand, resisting. I'm going to force her into more external rotation. She's resisting that. 4, 5, and then I'm going to get that last bit of stretch and hold it there for that 30 seconds. Once I'm done, I'll gradually release, lower back down, and then that's the piriformis stretch using reciprocal inhibition or PNF technique.